It started as a dream vacation, a luxury expedition cruise sailing across the Atlantic. Passengers were photographing wildlife, enjoying expensive dinners, and posting smiling photos online. But within days, people started getting sick. High fevers, breathing problems, severe exhaustion. Then came the deaths. Soon, governments, airports, hospitals, and even the World Health Organization became involved. The ship was isolated. Passengers were tracked across countries, and the internet exploded with one terrifying question. Is this the beginning of another global outbreak? The center of this story is the Dutch expedition cruise ship called MV. In April 2026, the ship left South America, carrying passengers and crew from multiple countries. The voyage was supposed to be a luxury wildlife expedition through remote regions. But somewhere during the journey, something went horribly wrong. One passenger reportedly became severely ill on board. Then others began developing symptoms. Some experienced fever, muscle pain, and stomach problems. Eventually, dangerous respiratory complications occurred. At least 3 deaths were later connected to the outbreak. Health authorities soon identified the virus involved as the Andes strain of Hantavirus, one of the rare hantaviruses capable of human-to-human transmission. That discovery immediately raised global concern. Most people had never even heard of hantavirus before this. Hantaviruses are a group of viruses usually spread by rodents. In many cases, humans become infected after breathing contaminated dust particles. Symptoms often begin like the flu, but in severe cases, the infection leads to hantavirus pulmonary syndrome, a deadly respiratory condition with a high fatality rate. What made this outbreak especially frightening was the specific strain involved. Andes virus. Unlike most hantaviruses, Andes virus has shown the ability to spread between humans through close and prolonged contact. Cruise ships are often described as floating cities. Thousands of people share the same dining halls, ventilation systems, and elevators. And once a contagious illness enters that environment, containment becomes extremely difficult. We saw this during COVID-19. And now, the MV Hondius situation has reignited those fears. Some passengers disembarked before the virus was fully identified. Others boarded international flights. The World Health Organization quickly stepped in, coordinating with countries under international health regulations. Medical teams were deployed. Diagnostic kits were shipped internationally. Passengers were monitored and quarantined. As news spread online, fear spread even faster. Social media users began comparing the outbreak to the early days of COVID-19. Conspiracy theories exploded across TikTok, Reddit, and YouTube. Some people claimed governments were hiding the truth, but experts repeatedly emphasized, this situation is serious, but it is not another COVID-level outbreak. The MV Hondius outbreak became a reminder of how connected the modern world really is. One ship, one virus. After COVID-19, the world is terrified of history repeating itself. And maybe that fear spreads faster than any virus ever could.